Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. First, we will welcome Vicki Morton of Novant Health Brunswick Medical Center's Anesthesia Group. Then, physician assistant Sarah Mojazzo will join us from Novant Health Oceanside Family Medicine and Convenient Care. Finally, we will meet Novant Health Brunswick Medical Center's nurse manager, Will Jones, and physical therapist, Dan Weckl. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Vicki Morton, Director of Clinical and Quality Outcomes with Novant Health Brunswick Medical Center's Anesthesiology Group. Welcome, Vicki. Thank you so much for being here today.
Thank you for having me.
Now, I understand that you're with Providence Anesthesia Associates, and that's the anesthesia provider for Novant Health Brunswick Medical Center, correct?
That is correct.
And so tell us a little bit about the group and your role within the group.
Sure. So Providence Anesthesiology Associates is based in Charlotte, and they have approximately 70 anesthesiologists.
Wow.
We started providing anesthesia care to Presbyterian Medical Center back in 1991 and have been a partner with Novant Health since its inception. My role as the Director of Clinical and Quality Outcomes and a nurse practitioner is really to work with the group and making sure that we're providing the best evidence-based medicine and best possible care to our patients. With that, we do have a large program that we partner with Novant on called Enhanced Recovery After Surgery, and my role with that is to oversee it, implement in various hospitals, expand the program, and making sure that it's running smoothly.
Well, let's back up just a little bit. You mentioned that you're a nurse practitioner. So tell me about your background. How did you and when did you become a nurse practitioner?
So I was a bedside nurse in critical care areas for several years, various ICUs, medical, surgical, cardiac care, trauma. And I left the bedside to enter into organ procurement, and I worked with organ donors and their families for several years, and then decided to go back to school. I went and got my doctorate of nursing practice and nurse practitioner a couple of years ago, and while doing that was working for a medical device company called Edwards Life Sciences and was one of their clinical educators. I did a lot of work with various facilities around the area, helping them to implement their enhanced recovery programs and various elements of that. And then I also did my dissertation in enhanced recovery in a very large surgery called Weckl that is very complex, and I chose that and am so passionate about ERAS because I have a family member who went through that many years ago and did not fare well, had a lot of complications, had a subsequent kidney transplant, and I just thought there had to be a better way.
So we're here today to talk about the Enhanced Recovery After Surgery program. So let's start with the basics, first of all. What does that mean?
In a nutshell, Enhanced Recovery After Surgery, or ERAS, reduces the surgical stress response, which improves clinical outcomes.
Okay, and I understand that this new program will be available to colorectal surgery patients initially. Is that correct?
Initially, that is correct, and I believe we have our first patient coming through the first week in May.
I see. And tell me about the experience. How will that differ for these patients?
Sure. So with Enhanced Recovery, one of our main goals is to make the patient a partner with their own care. We very much involve them, and that starts with patient education, extensive patient education before surgery, where we give them instructions on what they need to be doing leading up to surgery to help improve their post-operative outcomes, as well as doing things like giving them carb-loading drinks to take the night before surgery, the morning of surgery, allowing them to drink clear liquids up until just a few hours before surgery.
Really? Well, that's a change.
It is a big change, big change. And then also allowing them to eat very quickly after surgery, getting them up, mobilizing them very quickly after surgery, giving them things like multimodal analgesia to help reduce the need for opioids to treat pain, because we're treating them with this multimodal approach, as well as elements such as preventing postoperative nausea, vomiting. So it's a very multifaceted pathway.
Okay, though the care team at the hospital, then, they have specific actions that they do once the patient has been admitted to the hospital. Is that correct?
That is
and
correct.
how would that change their normal routine? How would it be different?
Well, with this pathway, every surgeon who is involved with each patient, everybody does the same thing every time.
Right.
They all have their checklists, if you will, in every care area. So the pre-op nurses know exactly what they need to be doing, all the way through to the floor. And so it changes in the sense that it is just a little bit of a different approach with the ERAS patients. And so we give guidelines in which the care providers follow to make it a little bit easier.
And did this program require special training or education for the physicians as well as the nurses?
So all of the clinicians went through an education that they learned the how, the why, the what behind enhanced recovery, why Novant was invested in doing this. And so once they go through that education, then they also learn all of the protocols and the elements that are involved. And it's essentially, you know, we're changing a culture here. We're changing an entire approach to surgery. So we're challenging the status quo with this program. What used to be done for surgery and how patients used to go into surgery is very different now. So they do go through a lot of education and follow-up and continued education.
Well, this sounds like an amazing service for patients. So we're about out of time, but is there anything else that you would like to share with our viewers before we wrap up?
Yes, so the program with Novant started back in May of 2016, a great partnership with the anesthesia group, Providence Anesthesiology, and hospital leadership, and then our surgical partners. With the program, and since the start, we have been able to reduce the length of stay, reduce complication rates, and patients are just overall more satisfied. They're much more satisfied. So we're going to continue to work towards this, partner with Novant. We very much feel that, you know, working with our hospital partners and the care team is a great approach to the best patient care that we can offer.
Right. Well, again, thank you so much for being here today, Vicki. This has been a great experience, and I look forward to hearing how it goes with the first few patients.
Thank you very much.
You're welcome. Next, let's meet Sarah Mojaza, physician assistant with Novant Health Oceanside Family Medicine and Convenient Care. Welcome, Sarah. Thanks so much for being here today.
Thank you for having me.
Great. Now, I understand that you're a PA.
Yes.
And I'd like to know a little bit about your education and your background. So where did you grow up?
Well, I was born and raised in Utah.
Nice.
And I went to school, did my bachelor's degree at the University of Utah, where I majored in education, health promotion and education with an emphasis in emergency medicine. I got my firefighting and emergency medical services degrees there. So
you were a firefighter?
Yes, I was. And, probably one of the smallest ones you've ever seen, which made it really easy to get through the studs between the walls. But I had a real knack for that trauma side of things.
Nice.
I really liked that. And then while I was doing that, I worked with the little babies on the mom-baby unit for a while and really enjoyed that.
You have a very varied background.
Very broad. And then I went to PA school at Hofstra University in New York for 2 years, and now I'm here.
Great school. Well, now that you're here, what interested you in coming to this area?
You know, I was on my way to New York for PA school.
And you just dropped by.
Yeah, quite literally. I actually had never traveled much, and a friend said, hey, go to Charleston, South Carolina. So I did, but it was the middle of August. It was really hot, so I didn't quite like it at the time. I do now. But then I moseyed on up here, drove right to the waterfront, walked on the beach, fell in love with it, and we've been coming back ever since.
Wow, that's interesting. Well, we're really certainly happy to have you here and in our area. For our viewers who may not be familiar, can you share a little bit about the Novant Health Oceanside Family Medicine and Convenient Care where you currently work?
Yes, so we actually have quite a large practice. We have family medicine providers, we have doctors, we have nurse practitioners and physician assistants, and then they provide care across the spectrum of all ages. With any primary care needs you have, anything from diabetes to sports physicals and wellness checks, and then on my side of the clinic, we have...
well, let's talk about your side of the clinic.
Yeah.
Is that the convenient care?
Yes, so I do more of the convenient care side of things, and, well, I wouldn't claim it mine, but we all work together. And we do more convenient care, it's
kind of like
an urgent care. Right, exactly. So we call it convenient care because we want
Because it's convenient.
It is. It's convenient. We're open a lot of hours during the day, every day, weekends. Monday through Friday, 8 a.m. to 8 p.m., and Saturdays 9 to 6, and Sundays 12 to 5. So we're open a lot, and you can come in for anything from small cuts. We can do stitches. We can diagnose you with broken bones. We can take care of your sinus infections and your colds and even the flu.
Now, do you have to be a patient of Novant Health Oceanside Family Medicine in order to use the convenient care, or is it open to everyone?
It's open to everyone.
That's nice.
Yep, whether you have insurance or not.
Yeah.
Everyone's welcome to come. And but it is a nice perk for the patients of our clinic because their own doctors are there and all their records are there, so we can check and see what they've had done and kind of follow up on their care. So
right. Well, what kind of services are typically offered in convenient care?
So, like I said, we do stitches. We see broken bones. And
so, like, if I went to the beach and cut my foot on an oyster shell, that's perfect.
Yep,
right?
we can handle that. If you have a cold, a sinus infection.
How about people here on vacation and they get hurt or whatever, and that's an option for them too, right?
Yes, minor injuries. We would encourage you to go to the emergency department for things like active chest pain.
Right.
If you're really having a hard time breathing.
Right.
If you have a really deep cut, things like that. But pretty much other than that, we see a lot of stuff, and we're happy to see you. And if we can't handle it in our clinic, we will send you to the people who can.
Yeah, I wanted to ask you that. So you could have them transported or
we can
sent to like the emergency department if it's something that should be seen.
If it's something more serious.
Yeah. Yeah. Now, you said you see patients of all ages. Is that correct? So you see children and babies and
babies on up. Yeah.
Yeah. Well, I'm curious, what interested you most about working with Novant Health Oceanside Family Medicine and Convenient Care? Was there something there that just intrigued you? You thought that would be a good fit for you?
Well, I love this area. I love all of the people here. Everybody's just so
nice. Yeah.
Right. And, I've worked for a big hospital system before back home, and I loved it. Everything was so organized. And I went to interview there, and everybody from the doctors to the nurses to the other providers, nurse practitioners and PAs, to the secretaries up front, everybody was just so incredibly nice.
Yeah,
everybody,
they were very nice.
And just working there, everybody is so good at what they do and so helpful. So that's what I love about Novant itself. And it's such a big network. So if I need to send somebody to orthopedics or to a hearing and balance place, I know that we have connections with somebody that we can get them seen in a timely manner.
Yeah, that is really nice, and I love with the the EMR system, the Epic system that we have, that everyone can see those records, and it's just so seamless. You go to another physician, and they've got all the information right there. You don't have to remember it in your head so much. So that's great. So you seem like you love the area, and you have so much energy. What do you do in your spare time?
Well, I love to fish. That's one thing that drew me down here. I do a lot of fishing from the pier and from the beach and from the boat.
Nice.
And then I do a lot of woodworking.
You build things?
Yes, I build things, furniture. I build all sorts of cool things. Signs made out of wood. I just built a porch swing, dining room tables, that kind of stuff.
Wow, you are so interesting. You have so many facets about you. You're a great person to talk to. Well, before we wrap up, is there anything else that you'd like to share with your patients out there?
No, I think that's great.
Good. Well, great. Thank you so much for being with us today. You've been so interesting, Sarah, and I look forward to speaking to you again.
Thank you.
Now, let's welcome Will Jones, Novant Health Brunswick Medical Center's nurse manager for the Med-Surg department. Welcome to the show today, Will. It's such a pleasure to have you.
Oh, thank you for having me.
I'd like to start off by learning about you and your background. So tell me a little bit about yourself.
Well, originally I'm from West Virginia. Escaped as a young man and lived in Escaped. No, the cold weather. I had some
opportunities. That's right. I
yeah.
understand. I'm from West Virginia too.
We don't have to shovel sunshine down here, so that's why we're
nice,
here.
Yeah.
But I'm from West Virginia. I lived in South Georgia, North Florida for a number of years. Served in the military down there. Subsequently went to college, and then thought I'd meet a fancy Southern girl, and met a girl from West Virginia in Florida.
You're kidding.
So we ended up back in West Virginia for a couple of years while she finished a master's, and then fell in love with Southport a couple of years back, and we will be here 2 years this May.
Wow, that is nice, interesting. So tell me a little bit about your role at the hospital.
I am the manager of the medical surgical department on the second floor.
On the second floor. Yes, and when did you take that role of manager position, Will?
January.
January.
Yes, ma'am.
So you've been here a while. So, well, I know we refer to it as the Med-Surg department, and I don't think everybody knows what that really means. So tell me what exactly is the Med-Surg department?
Well, we are a 50-bed floor where we take care of 16 years of age to adult across the lifespan of medical and surgical issues. Medical surgical nursing is an exclusion field in the sense that we do not take care of a specific disease process. We take care of a little bit of everything. So our staff and nurses need to be able to take care of a diverse population with complicated medical issues and be prepared from the medical side, acutely ill patients, to the surgical, post-operative, and pre-operative. So we sort of take care of the whole ball of wax, if you will.
So the patient population is a mix of surgical and medical.
It is very
patients.
diverse, yes.
Yeah. So what if they have a higher need, a higher acuity level? What happens there?
Well, for instance, the third floor houses the ICU and the PCU, a progressive care unit. So think of it in terms of steps. If you needed a higher level of care that we may not be able to provide due to acuity, or perhaps a drip that you may require, you could go to the progressive care unit, which is a step down from the ICU. And then inversely, you may come back the opposite direction as you progress.
Well, that's what I wanted to ask you that. I know that in years past, a patient in ICU usually went to what we called the step-down unit, so the progressive care, and then maybe on down. Is that still the norm?
Correct. Now, someone may be doing fantastic in the progressive care unit and be discharged from the PCU, if you will. However, the natural progression would be progressive care down to the medical surgical department, where we could continue to accommodate your needs and then plan for your discharge.
I see.
So that's where we want to transition you home to your primary care physician at some point, but we, again, continue to provide that care throughout the facility as your needs either increase or decrease in anticipation for discharge.
Well, I know that you and your team have a lot going on. What are some of the initiatives that you're currently working on?
Well, one that I really like, there's been a paradigm shift in healthcare with, instead of you being our patient, we are your healthcare provider. So we really strive to deliver on the human experience, to involve the entire family, to involve, to provide you what you want out of your healthcare experience. And that's something that we take great pride in, and that we really want to, we strive for that in every encounter with every patient.
That's great. That sounds wonderful. Well, tell me, what would you like your patients and families out in the community to know about Novant Health Brunswick Medical Center, as well as the Med-Surg department?
Well, we aim at giving a remarkable experience every single time in everything that we do. And it's humbling, and we are honored that people reach out to us and choose us as their healthcare provider, and it's a lofty promise that they've asked us to accomplish, and we like to deliver on it. So, you know, the Med-Surg department, I tell people when they leave, I never want to see you again here. I would love to see you in the community, and it's great serving your neighbors. You see John at the store, and John feels better. You know, it's really, like I said, a humbling experience to be part of something that is greater than yourself when people are at their most vulnerable. So.
Yeah, that's true. Well, it's time for us to wrap up, and we so appreciate you being here. What a great service you're providing for the community, and we appreciate you sharing that with us today.
Well, thank you. Thank you for having me, and I want to compliment my team, because for me it's an honor to lead a team with that much courage and compassion from day to day. It's a joy to wake up and go in and like I said, be part of someone's experience at Novant Health.
That is wonderful of you to say that, because sometimes we forget about the people that make us what we are.
Yes,
so congratulations to you and your team. Great job.
Thank you.
Thank you. Next, let's meet physical therapist Dan Weckl. Well, welcome back to the show, Dan. It's great to see you.
Thank you very much. Appreciate that. Glad to have the chance to be here.
Good. So let's get to know you a little better again. Tell us about yourself and talk to me about your education and your background.
All right, well, that'd be fine. I'm a licensed physical therapist, been practicing since 1982. And I've been with Novant Health for a number of years, and most recently, for the last year, I've been at the Calabash Outpatient Center right here in South Brunswick County. So
that's a really nice office, too. That's a great place.
Yes, ma'am.
Yeah. So it sounds like you have extensive experience in providing physical therapy services. You've been in practice quite a while.
Oh, yes, ma'am. I've been doing this for a long time, and have had a variety of experiences in both outpatient care, inpatient care, rehabilitation. So a pretty good wide range of experiences that I bring to bear on the.
Yeah. As a side note, I know one of your patients, and she says wonderful things about you. She just raves about your care. So.
Well, I'm certainly glad to hear that.
You come well recommended.
Thank you very much. I sure appreciate that.
So now I know that you're at the Calabash location, and I understand that they're moving to the Novant Health South Brunswick Medical Plaza in Carolina Shores. That is a mouthful.
Yes, ma'am. Well, we've been at our current location for the last year, and at the end of the month, we're transitioning over to the new building on Highway 17 to be part of the physician office group. So that is a recent change in our location, but we're hoping to offer the same level of service and same great care that we've been providing for the last year. So.
Well, for our viewers who may not be familiar with that new location, tell me a little bit about that location and those services. Now, it's located in Carolina Shores, is that correct?
That's right. It's 75 Emerson Bay Road in Carolina Shores, and we are, the physical therapy department, if you want to call it that, is going to be located within the physician office building. So we are going to be right in the midst of the physician practices there.
So you'll be embedded in the practice that's
Yes, ma'am.
currently there.
That's correct. So we'll have a lot of interaction with the doctors on a
That's
regular
good.
basis, and we'll have probably a little faster access to patients that need care on an immediate basis.
So will you be providing the same services there that you've been providing at the Calabash practice?
Yes, we will. Everything will remain the same. I'll still be the practicing therapist at that location, and hopefully everything will go smoothly along.
Do you think if a physician or a practitioner there at the clinic would have somebody that they needed an opinion about physical therapy, would you be available for a consult in a timely fashion? Probably like while they're in the office there?
Yes, and I expect that'll probably happen as well. I know a couple of the doctors at that location do use our services regularly, and I'm sure that we will both enjoy the chance to have that more regular interaction.
I think the patients would love that. You know, love to have that almost immediate.
Yeah, and I think it shows us that'll show the patient that we're a part of the physician's practice.
Right.
And we have a lot of communication directly with the doctors, and ultimately I think it just means better care for each client.
I do too. I mean, I just think that's so convenient for the patients, and after all, that's what it's all about.
Exactly.
You know, providing that great care. I'm curious about the most common services that you provide. What's your most common ailment, so to speak?
Probably the most common things that we see are either aftercare for joint replacement, surgery, rehabilitation for joint replacement, hip and knee replacements. And I would say we also see a lot of neck and back dysfunction, patients with pain in the spine or pain in the hips resulting from degenerative changes. Those are probably some of the more common things, but we also enjoy a wide range of other diagnoses.
I was going to say, conversely, what are your less common conditions?
Goodness. Well, gosh, I've treated temporomandibular joint patients.
Is that like a jaw?
Yes, ma'am. We see shoulder dysfunction. I've had a number of foot and ankle related concerns come through. Certainly all the usual sprains and strains that come with slips and falls and overuse syndrome. So,
this being a touristy area, do you ever get the occasional tourist in for some sort of a treatment?
We do, yes, ma'am, we do, and also we enjoy clientele for those folks who live elsewhere, but they own a secondary home here, and they're down for the winter or they're down for the summer, and then unfortunately something happens that requires them to get care, and then we're right here for them. So I know we've had several cases where they've really appreciated the chance to get excellent physical therapy while they're away from home. So,
How about referrals? Do they need a referral to see the physical therapy to be?
Usually they do come with a referral.
Pretty much.
It's not required in the state of North Carolina. We usually do follow up, though, with an immediate plan of care that the practitioner does have to sign. So once I evaluate the client and we send back a plan of treatment to their preferred physician, then we do ask that the doctor sign off on the plan of treatment. But they do not need a referral to initially present for care.
I see. I know there's other locations besides the Carolina Shores. There's one in Charlotte. Is that still remaining there?
Absolutely. 4500 block of Main Street in Charlotte. We have our main clinic, and that is certainly still viable and operational at this time for those clients that live a little farther north. So.
Okay, great. If there's a viewer out there who would like to make an appointment with you, how might they do that?
Best thing to do is call us at our current number, which is area code 910-721-4080. Just call 721-4080, and we'll be happy to set up an appointment time. And
great.
We have hours from 8 to 5:30, so
great.
We're able to accommodate most people at their preferred time.
Well, thank you so much for coming back and catching us up, Dan. It's been a pleasure to have you, and I look forward to hearing about all the new things that are going on at the Carolina Shores office.
Glad to do it. Appreciate the chance to be here.
No worries.
Thank you.
Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit NovantHealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.